Hello, my name is Sherry Bailey. Today I will be doing my video presentation on healthcare delivery and quality. Um, we were presented with a case study and then we were asked to explain why insurance companies should or should not pay for injuries, extended costs, readmissions, or deaths for hospital-acquired infections or medical errors. So I do not believe that insurance companies should pay for those things because they're preventable. In one case study, 35% of patients that tested positive for VRE, MRSA, and C. diff were readmitted to the hospital. Patients that had surgical site infections with MRSA were readmitted within 30 days of discharge. So all of these infections are preventable. Most commonly, they're preventable with the proper training in place and making sure that your staff are constantly being trained. It's not just a one-time thing. But if you train them on how to use proper PPE, make sure that they're following their contact precautions appropriately, making sure that they're sanitizing or cleaning off patient equipment that's being used in those rooms that patients do have C. diff, MRSA, those things, making sure that you're cleaning the equipment appropriately. That's important, but that's all training that can be done and followed in order to prevent those things from spreading to other patients. According to Rodzwitsk and Hipskind, medical errors are a leading cause of death in the United States. So there's a couple different types of medical errors. There are errors of omission, which would be like forgetting to do something. Like say you put the patient in the bed, but you forget to put one of the bed rails up, so the patient rolls over and falls out of the bed. That would be an error of omission. Or an error of commission, in which the wrong action is taken, therefore something negative happens because of it. That would be like maybe giving a patient the wrong medicine. That would be an error of commission. But either of those things are also preventable. One of the big reasons that errors are such a big deal in the medical community is that a lot of people are afraid to admit to them. They're afraid to lose their job. They're afraid to get in trouble. I do think that taking the stigma out of admitting to your errors would be a big help in the hospital industry and in the medical community, just for patient safety. I mean, all healthcare professionals are humans. We all make mistakes, but it's important in order to avoid making more mistakes like that to be sure that you're, reporting those things appropriately. Let's see. Because hospital-acquired infections and medical errors are so preventable, I do think it's important that hospitals and other healthcare industries, not just hospitals, take the appropriate actions to make sure these things don't happen. One thing that can make sure that they have the incentive to, do the proper training, make sure that their employees know what to do if this happens. They know they're properly trained with hospital-acquired infections and, how to transport patients and all those things that can lead to medical errors. In order, making sure that they know those things kind of gives them, it helps patient care by improving the quality of care that the patients are getting, and it helps to make sure that these preventable things don't happen. A couple more ways that you can improve patient safety and reduce errors in the healthcare setting. One of them would be to utilize hospitalists as team coordinators. I know in my hospital we do have hospitalists, and they're great because it kind of helps to make sure that there's a continuity of patient care. In one article that I read, hospitalists can help by monitoring medication distribution, chairing pharmaceutical and therapeutics committees, overseeing computerized physician ordering entry, directing quality performance improvement projects, and collaborating with discharge planning and case managers. So this kind of having the hospitalist kind of helps to reduce in the amount of handoff you have to give by reducing the handovers in that sense. It helps to, reduce errors that can occur, like miscommunications of, what happened during the day, miscommunications of patient information, things like that. It does help to have like one single person in every aspect of the care. Another way to help reduce patient errors is by involving the actual patients and their families in their care. By making sure that patients and families are involved in the plan of care, it helps to make sure that everyone understands how the transitioning of care will go. Like if you're getting discharged home, make sure that the patient knows and understands their discharge instructions, and their family members, if, there's family that's going to help them in it, or however that goes. But also, like if you're staying in the hospital and it's like shift report, if you're doing bedside shift report, that, and if a nurse forgets to mention something in report, or maybe they say something incorrectly, because nurses are humans and we've got more than one patient, that patient can then step up and say, hey, no, this is what happened instead, or I did get this medicine, or, it helps in reducing patient errors. By creating incentives for providers and healthcare organizations, this encourages them to set and follow certain protocols regarding services and care. So it's kind of like having a set thing that you do. Obviously, all patient care is, it's unique to that patient. You have to alter it in different ways, but having those protocols in place helps to provide a baseline. That way you can be sure that you're reducing the errors that are made and reducing hospital-acquired infections and things like that can be prevented. So by making sure that, hospitals that have excessive hospital-acquired infections or have excessive rates of medical errors aren't getting paid for those things, it definitely makes sure that those hospitals, they're not going to want to keep doing the same things. They're going to want to change their protocols, change their policies to make sure that those things are being prevented.